Hello, I'm Karen Forston. I am the Executive Director for the Prevention of Blindness Society of Metropolitan Washington, and thank you so much for joining us today. Our organization has been around in serving the Washington, D.C. metropolitan area since 1936 and is focused on eye health in our local community. Today, we are here through the Ray Artisans to talk about the healthy aging eye. And we're very fortunate to have Dr. Suleiman Alibhai, who is a leading optometrist in our community and is focused on low vision. And low vision is frequently tied in with the aging eye. And so we're very fortunate to have him today to share information with you. I encourage you to enjoy the presentation. Feel free to reach out to us via email for questions afterwards. And check out our organization at youreyes.org. We have a lot of services in our community, and many of them are at free or no cost. So I'll turn this over to you, Dr. Alibhai.
All right. Well, thank you very much, Karen. It's my pleasure to be here today to talk about the aging eye. And I'd like to begin with the first slide, please. So, you may have noticed changes with your eyes as you get older, and many of these changes are common and can be corrected. But as you do get older, you're at higher risk for age-related eye diseases and conditions. So the important point here is that all of our eyes do age, and that many of us just need a better pair of glasses. One of the most common aging changes we notice is that we need reading glasses. But certainly there are some risks to your eyes as you get older, and we're going to talk about some of these today. Could I have the next slide, please? The most important thing is that once you're 50 or older, you should have a comprehensive dilated eye exam, and it's important that all of you have established a good relationship with an eye care professional who can perform this dilated exam on a regular basis, and he or she will be the right person to guide you as to when it's appropriate to have that done. Could I have the next slide, please? So some important factors about aging and the aging eye. These three things are common to all of us as we age. We need more light, we have more issues with contrast, and we have more issues with glare. So in simple terms, as we get older, we need more light, and an 80-year-old would need twice as much light as a 20-year-old. Contrast, that just means things have to be more black on white. So if you're writing things, you might find it's easier to see if it's written with a bold black pen instead of just a pencil. And you may find it becomes trickier sometimes to notice the edge of steps and curbs, or when you're driving, the lines on the road. Glare, that's to do with the brightness of light. It could be indoors or outdoors, but typically when we're driving at night, people complain that the headlights of cars are more bothersome, and that's a good example of glare. So these are some typical aging changes that we would all experience. Next slide, please. Here's a slide which talks about visual impairment in general, and it says that 14 million people in the United States are visually impaired, but 3 million of these 14 million would actually have a visual impairment that is no longer just a problem with not having the right glasses or not having the right contact lenses, but these are the diseases of the eyes which have impacted their vision. So today our focus will be on those conditions that impact 3 million Americans because of typically aging changes, and we'll discuss some of these. Could I have the next slide, please? So the most common aging diseases of the eyes are cataracts, glaucoma, diabetic retinopathy, macular degeneration, dry eyes, and low vision. So we'll try and take each one of these in turn and discuss them in a little more detail. Could I have the next slide, please? The four most common issues that cause blindness, and blindness can be defined not just as not being able to see at all, but in this country we often define legal blindness, which means your vision is on the eye chart no better than 20 over 200. Most of us know that 20/20 is normal vision. So even with glasses or contact lenses on, if your vision on the eye chart is no better than 20 over 200, then that's considered legally blind. And so these four conditions here actually can cause blindness in the sense of legal blindness, but two of these could even cause blindness in the sense of total blindness. So these conditions are the advanced age-related macular degeneration, and in 2020, there are probably almost 3 million people who have advanced macular degeneration. Glaucoma, and again, it's about 3.3 million people have glaucoma. This is one of those conditions that can cause actual total blindness. Diabetic retinopathy, 7.2 million people have diabetic retinopathy, and this is another one of those conditions that can cause total blindness. And cataract, and even though we can see there are 30 million people with cataracts now, this is one of those conditions that we can actually cure by having successful surgery done. Could I have the next slide, please? So let's talk about the population over the age of 40. And as this graph here shows, the largest percentage of people who have an age-related eye disease over the age of 40 tend to have cataracts. The next most common is the diabetic retinopathy, then glaucoma, and finally age-related macular degeneration. And this is why, right at the outset, the emphasis was it's very important that if you're aging, you have an eye exam with an eye doctor who's hopefully going to provide a dilated eye exam in which they're going to look in the back of your eyes and look for these aging changes very carefully. Now, all of these aging changes cause those problems I discussed earlier with needing more light, needing more contrast, and having more issues of glare. So you might have one of these conditions and just think, well, that's normal aging. Well, it's very important that you have this dilated fundus exam and see your eye doctor regularly so they can check to make sure those symptoms you're experiencing are not related to one of these. Could I have the next slide, please? So here's a simple diagram of the eye, and the eye is much like a camera, and the important parts of the eyes, the front of the eye that we call the cornea, that's like a clear window pane. So the condition of dry eyes will tend to affect the cornea. Then we have the iris, which is the colored part of the eye, and there's a hole in the iris that's called the pupil that lets light into the eye. The next structure is the lens, and it's the aging of the lens that we call cataract. And as I mentioned, nowadays we can cure cataracts. So you can have cataract surgery and that lens can be replaced. And then the lining in the back of the eye is called the retina. And if this was a camera, we would call the retina the film. And this retina, this film, takes a picture, and the picture is sent to your brain along the optic nerve. So the optic nerve is the part of the eye that develops glaucoma, and that's where your doctor will be looking for changes in the eye when you have glaucoma. The retina can develop macular degeneration, and there's one small part of the retina which we call the macula, which is where the best clear, sharp vision is, the vision to read a book, to recognize a face and thread a needle, and that's where you develop macular degeneration. And that's one of those things that will have to be examined by dilating the eyes and looking at that structure very carefully. Thank you. Next slide, please. Here's an actual picture of the retina if you were looking into it through the pupil. Now, you can only see the retina like this when you have a dilated eye, meaning drops have been put in the eyes and your pupil is made larger so you can actually see inside the eye. And the important parts of the eye here are the macula, which is the area right in the center there, and you can see all the blood vessels lead to the macula. And we have the optic nerve, and that's the cable that connects the eye to the brain. So when you're having a dilated eye exam, your doctor's looking at the structure of the blood vessels. If those blood vessels leak, you could have diabetes. Looks at the optic nerve. If the optic nerve is being damaged by pressure, it'll look pale, and that would be glaucoma. And we're looking for changes to the macula. Here you see the macula just looks like a darker area, but when we see some pictures of macular degeneration, you'll see the damage that's done by macular degeneration. Can we have the next slide, please? So the first thing we'll talk about are cataracts. And as I mentioned earlier, cataract is the most common cause of aging eye changes. And we talked about 30 million people today in the United States have cataracts. And cataracts can be in various degrees. Many people think of cataracts ripening, and sometimes patients will talk about my cataracts are not ripe and not ready. And really, we're referring to the lens in the eye turning cloudy or yellow. The more the lens turns yellow and cloudy, the more we talk about a cataract. So this is a photograph of the front of the eye, and the pupil is dilated in this photograph, and you can see this cloudy lens, which we would now call the cataract. Can I have the next slide, please? So who's at risk for getting cataracts? Most of us get cataracts simply because of age, and if we spend a lot of time outdoors, don't wear our sunglasses or don't wear a hat, the UV light tends to speed up the process of forming cataracts. Smoking, people who smoke have a much higher risk of developing cataracts. And diabetes. Diabetes can cause cataracts even in young people. Can I have the next slide, please? Here's a picture of somebody looking at two children, and if they have cataracts, the image looks blurry, and this is blurry throughout the picture, and the features and details of the faces are hard to see. It's like looking through a dirty window pane, if you like. Next slide, please. Here's another example. This time we have a lighthouse on the left side. It's under normal sight, and the sky looks blue, the grass looks green. And in the eye with the cataract, the blueness of the sky is lost and the greenness of the grass is gone. Next slide, please. One of the big risk factors of having cataracts is falling. And again, there's a statistic which says that as we get older, our risk of falling increases, and sometimes it might be related to cataracts. So, for example, here's a flight of steps that you might have to come down, and when you have a cataract, the image is much blurrier, it's much harder to see the edges of these steps, and that's what increases the risk of falling. Next slide, please. Turning now to glaucoma. So glaucoma is affecting that nerve, that cable in the eye. And in this diagram on the left, it's a normal nerve or a normal cable. And here the optic nerve is round, and the cup, meaning where the nerve fibers are traveling back to the brain, nicely packed into a tight bundle. And so we call the whole nerve the disc, and this area of nice tight bundle of nerves going back to the brain, the cup itself. And this cup is a normal size. In the image on the right, we have the disc still shown there. That's the nerve itself. But you can see here the cup itself, where these nerves enter the optic nerve and travel to the brain, is much larger, and that's because of pressure. So glaucoma is caused by pressure in the eye, and we don't really know why people develop glaucoma or why they develop pressure, but that increase in pressure damages the nerve, and then the nerve is not able to send the picture back to the brain as well. So again, this is something your ophthalmologist, your optometrist is looking for when they dilate your eyes at the normal appearance of the nerve versus the damaged nerve from glaucoma caused by pressure. And for most of you who've had an eye exam, you know you've had your pressure measured. And so it's very important during your routine eye exam to have the optic nerve examined and the pressure in the eye measured to make sure that that pressure is not causing any damage. Next slide, please. Here's an image of somebody who has glaucoma, and glaucoma tends to affect the peripheral vision. And in this picture, you can see the two faces of these children very clearly, but the edges are sort of dark. And the implication here being, as the glaucoma progresses, you get more and more tunnel vision. And as I mentioned very early on, you could go totally blind from glaucoma here because that tunnel could close completely. Next slide. Turning now to diabetic retinopathy. These are images again of the back of the eye, and the image on the left shows the effects of diabetes where we have hemorrhaging and cotton wool spots, and on the right you can see changes on the optic nerve itself known as neovascularization. Now, of course, diabetes is a systemic disease. It's caused by either a genetic propensity for diabetes or perhaps diet, high blood pressure, cholesterol, and diabetic retinopathy is a manifestation of diabetes in the eyes. So the best way to avoid developing diabetic retinopathy is to make sure that if you have those risk factors for diabetes, then you are watching your diet, you're exercising, you're seeing your doctor to have your blood pressure measured, your cholesterol levels measured, and you keep things under control. But if you do develop diabetic retinopathy, then you will require treatments which will be geared to reduce these hemorrhages and changes in the back of the eye so that they don't develop further complications which could eventually cause total blindness. Next slide, please. Here's a very dramatic picture of diabetic retinopathy where you can see the blood vessels have leaked so much there's extensive hemorrhaging. The yellow parts again are these cotton wool spots, and there's swelling in this retina too. So many people with diabetes will say, I've had a dilated eye exam and I've been told I have swelling in my eyes. This is what they're referring to. The swelling is coming from all this leakage of blood and hemorrhaging of blood, and this eye will need to be treated. We don't have a way of replacing the retina, so it's not like having a cataract where I told you earlier that you can replace the cataract. We can fix that problem quite easily. In this case, the retina is not replaceable, and so this diabetes must be brought under control, and the diabetic retinopathy has to be treated. Again, I have to emphasize the most important thing is when you have diabetes is to control the diabetes itself that will prevent this presentation of diabetic retinopathy itself. Next slide, please. Here's an image of that same picture of the two little boys, but now with diabetic retinopathy. And you can see the diabetic retinopathy is impacting all parts of the vision. The peripheral vision shows some of these dark areas, the central vision, and again, there are these blank spots in the center, and there is no clarity to the vision either. So the image is not that sharp and clear. Again, as I mentioned earlier, people with diabetic retinopathy also tend to develop cataracts as well, which is a secondary complication. Next slide, please. So here's the most common cause of aging vision changes. It's called age-related macular degeneration. Next slide. And here's that picture of the eye again, of the retina. In this case, the retina has all these little yellow dots, which are called drusen. And drusen is the first sign of age-related macular degeneration, and this is called dry macular degeneration. The drusen will cause atrophy, and that just means there will be areas of the macula which have parts that are not working and will interfere with the vision, and the drusen can also eventually lead to wet macular degeneration. So this is, again, not something in the early stage you may have symptoms of, but would require a dilated exam for the doctor to look inside to find these changes. Macular degeneration, as far as we know, is affected by, again, those same factors that cause cataracts: exposure to sunlight, smoking, diet, again, plays a big role in macular degeneration as well. We tend to encourage people to eat more leafy green vegetables, to eat more fish, and people with dry macular degeneration even take vitamins, which are antioxidants, to prevent the formation of these drusen. So the dry macular degeneration is treated more, again, with diet, not smoking, protecting one's eyes from the sun, and taking antioxidants. And the wet macular degeneration, which we'll talk about shortly, has to be treated in a slightly different way. Can I have the next slide, please? Here's one of the things that many people who have drusen in their eyes are often given by their eye doctors as a way of tracking their changes to their macula from macular degeneration. And this is called an Amsler grid. It looks like a graph. It should look like the one on the left. And the instructions typically are to look at the dot in the center of the grid and to look for any distortion. People with macular degeneration, and in particular people with wet macular degeneration, will get the type of distortions seen on the right side here, where you can see the lines are no longer straight, and instead of a small black dot, there's a big black dot, which we call a scotoma, and that's what interferes with the central vision, the vision to read, to see faces, and see more detail. Next slide, please. Here's a case of wet macular degeneration. So like I mentioned earlier, this is a more advanced form of macular degeneration, and this area here is from bleeding and hemorrhaging. So in wet macular degeneration, there are actually abnormal blood vessels that form underneath the macula, and they leak and they bleed. And if you don't treat them, they form this scar tissue, and of course it would be very difficult to see through this type of scarring. And that's why the wet macular degeneration is treated with injections to the eye. These injections stop these tiny little blood vessels from leaking and scarring, and most people with wet macular degeneration have to get a series of injections to continue treating these abnormal leaking blood vessels. Again, since we cannot replace the retina or replace the macula, there is no cure for macular degeneration. What we have to do is to try to preserve the functioning of the macula as much as possible and to keep the retina as healthy as possible. And for the dry macular degeneration, as I mentioned, taking the vitamins, protecting one's eyes from the sun, not smoking, having a good healthy diet is helping preserve the functioning of the macula, and the wet macular degeneration, having the laser treatments, will prevent these blood vessels from leaking and forming the scar tissue. In macular degeneration, you'll notice the peripheral retina stays intact. So if we look at the next slide, you can see in this image the person with macular degeneration can certainly tell that this is the face of a young child, perhaps, and can see peripherally the shoulders, the color of her dress, and even the fact that she might be wearing an earring. But the details are not possible. So recognizing this face would be difficult. So in macular degeneration, we tend to lose the central vision, lose the detailed vision, but keep the peripheral vision. In cataract, you saw that everything was cloudy, but at least you could see all the details, but the colors and everything looked faded. In glaucoma, it was the tunnel vision, but in diabetic retinopathy, it's a combination of all of these things, and it affects the periphery as well as the central vision. Next slide, please. So finally, we're going to talk about dry eyes. And this time we're referring to the outer part of the eye, the cornea, the outer lens of the eye, which is lubricated naturally by the eye. There are two types of glands. There's a lacrimal gland that produces the watery component, and there are these small, tiny glands in the eyelids, which we call the meibomian glands, that produce the oily component. So when we have dry eyes, which is very common in age because these glands tend to dry up and not produce enough watery or oily component, then the cornea becomes very dry and it feels gritty, and the eyes tear sometimes in reaction to all that, which is why people put drops in their eyes to continue to lubricate the eyes. One of the common things we're finding is that more and more people are spending so much time looking at a computer screen, looking at their phones, and they're developing dry eyes even at the age of 40 and 50. So even younger people are getting dry eye syndrome. So we've decided that we should observe the 20-20-20 rule. When you're sitting on a computer, make sure that every 20 minutes you take a break for at least 20 seconds and you look at least 20 feet away to give your eyes a break. And that's really going to allow that tear film to reform and prevent this dry eye problem that's very typical now, not just in the aging eye, but younger people are spending too much time looking at their screens. Next slide, please. Okay, so this was just a quick and brief overview of aging changes of the eyes. And the most important points to remember here are there are some natural aging changes of the eyes, like we mentioned, needing more light, needing more contrast, or having more glare sensitivity. But remember, there are some key changes that can occur from diseases of the eyes, which also manifest with similar symptoms. So it's very, very important that you get a regular eye exam, and ideally a dilated exam where drops are put so they can look inside the eye and check for glaucoma, check for cataracts, check for diabetic retinopathy, and check for macular degeneration. But if you have questions, if you need more information, reach out to the Prevention of Blindness Society here. The phone number here is 202-234-1010. And you can send an email to communications@youreyes.org. So if you have questions, if you want some more clarification on any of these changes to the eyes, please feel free to reach out. I thank you all today for listening in. Thank you very much. Bye-bye.